Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video we're going to talk about the START method, which is used in a disaster situation. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. The START method is used to help us determine what tag color a patient will be assigned during a disaster situation. And in the previous video, we went over the color-coded tagging system in detail. So if you haven't watched that video, I really recommend that you check that out as well. So the START method, START actually stands for Simple Triage and Rapid Treatment. And this particular START method that we're going over is for the adult patient. And it's very quick and simple to use. So the very first thing what you want to do is you want to look at that wounded individual and you want to ask yourself, what are they doing? Are they able to get up, move around, walk around, or are they unable to do that? Well, if they are able to walk around, that tells you something, that they're breathing, they have circulation, and their neurostatus is there, their mental status. So automatically they're going to be tagged a green. Now, the other part of the START method is for patients who are unable to move. So we're going to look at three things in this particular order. We are going to be looking at their breathing, circulation, neuro/mental status. And these wounded individuals are either going to be tagged red, yellow, or black. So with breathing, what we're looking at is if they're breathing and what's the respiratory rate. So let's say yes, they are breathing, but the respiratory rate is greater than 30. Well, we know that a normal respiratory rate in an adult is 12 to 20 breaths per minute. So if it's greater than 30, there's something wrong with this patient and they need immediate treatment. So this patient is going to be tagged red. Let's say they are breathing, but the respiratory rate's less than 30. Well, we're going to proceed and check their circulation. But how about if they're not breathing? What you want to do is quickly reposition that airway and reassess to see if they're breathing. If they're not breathing, they would be tagged black. Now let's say you reposition that airway and they are breathing. They have spontaneous breaths. Well, that lets us know that there's something wrong with this patient because they weren't breathing before, we repositioned their airway, and now they are breathing. So they need an immediate treatment. So they would be tagged red. Now we're going to look at circulation. And what we're looking at is if they have a positive radial pulse or their capillary refill is less than 2 seconds. That tells us this patient is perfusing. So let's say that yes, this is present. Well, we're going to proceed and check their neuro/mental status. But if this was not present, that tells us something's wrong. So they're going to be tagged red. Then we're going to look at their neuro/mental status. And what you're going to do with this is you're going to see if they can obey or follow your commands. And if they can do that, they will be tagged yellow. But if they cannot do that, they will be tagged red. So let's quickly review. So a patient is only going to be tagged green with the START method if they're up and able to move and walk around, because this tells us that they're breathing, they're circulating, and their neurostatus is there with their mental status because they can follow and obey your commands. Now for patients who are unable to move around, walk, they're either going to be tagged red, yellow, or black. So patients who are going to be tagged red are patients who are breathing but their respiratory rate is greater than 30. Or they weren't breathing at first, you reposition their airway, and then they have spontaneous breaths, they are breathing. Also, if their circulation is not present, they don't have a positive radial pulse, or their capillary refill is greater than 2 seconds, or if they're unable to follow your commands. Now the patient will be tagged black if they're not breathing, even when you reposition their airway. And they will be tagged yellow if they do have breathing, they're breathing less than 30, they do have circulation, and they're able to follow your commands. Okay, so that wraps up this review over the START method. And don't forget to access the free quiz that will test you over this content.